Hi, I'm Matt Groh, and I'm a final year PhD student at the MIT Media Lab. I'll be presenting research today on how we can increase transparency in the machine learning development pipeline, such that we can avoid systematic errors in algorithmic decision support tools, and, in particular, address how we can do this for large data sets of images of skin disease that are used for training models to classify skin disease. So this is joint work with Caleb Harris, Dr. Roxana Daneshjou, Dr. Omar Badri, and Dr. Arash Koochek. And it's at the intersection of computer-supported collaborative work, machine learning, and dermatology. Also, I want to mention up front that this presentation will include some clinical images of skin disease. So let's get started. AI systems hold promise for aiding healthcare professionals in clinical diagnosis tasks. For example, in a paper published in 2017 in Nature, researchers showed that convolutional neural networks in a very, very specific setting can classify skin lesions as benign or malignant at similar rates to board-certified dermatologists. And there's another article in Nature Medicine in 2020, so 3 years later, 2 years ago, that demonstrated a deep learning system based on a couple images and some metadata can classify skin disease at a similar rate to board-certified dermatologists and significantly more accurate than primary care physicians or nurse practitioners. However, the Nature paper did not report details on demographic or skin tone information about the images the model was trained or evaluated on. And in the Nature Medicine paper, they did report these details, but only included less than 3% of people with the darkest two skin types. In a recent review in JAMA Dermatology, researchers revealed that a vast majority of the data sets used for machine learning and dermatology do not actually contain skin tone labels. And in a recent consensus statement published in the same journal, researchers came up with a checklist for evaluating image-based AI, which includes 1 point on skin tone information and procedure, which skin tone was assessed by. Now, the most common method for incorporating skin tone information in algorithmic audits is using the Fitzpatrick skin type scale, which I mentioned earlier when I was referring to the two darkest skin types in the Nature Medicine paper. I'm presenting a screenshot from our paper, which shows the Fitzpatrick skin type scale as it was published in 1988. And what I want to do is note that the original scale does not include nuanced skin tones or color beyond white, brown, and black. And although Fitzpatrick's skin type scale is highly correlated with an individual's melanin index, which can be measured by narrowband spectrophotometric devices, the scale is a subjective measure, ultimately. And in clinical practice, which is generally in person, clinical Fitzpatrick skin types are visually assessed by dermatologists based on colors of a patient's skin, hair, and eyes, and most importantly, their history of sunburns. As researchers Joy Bulamwini and Timnit Gebru pointed out in their Gender Shades paper, Fitzpatrick skin type serves as a starting point for algorithmic audits, but it's imperfect given the coarseness of its categories. Now, to give you a sense of what these look like, here's one example of acne vulgaris, labeled as Fitzpatrick skin type 1 by crowd labelers. And here's an example of contact dermatitis, labeled as 3. And here's an example of pityriasis rosea, labeled as Fitzpatrick skin type 6. Now, given that there's some degree of subjectivity of estimating Fitzpatrick skin type from an image, one question is, who has the authority to do so? Who is qualified to do so? Should this be done by dermatologists? Could this be done by an algorithm at the same level of agreement as a board-certified dermatologist? And what about crowd workers? How would they compare to an algorithm or expert dermatologists? So we asked 3 board-certified dermatologists to label 320 textbook images of skin disease and 160 images from the Fitzpatrick 17K dataset, which is an open and available dataset for people to do research on. We also asked 2 companies specializing in crowdsourcing annotations. Those 2 companies are Scale AI and Centaur Labs, to annotate both the textbook and Fitzpatrick 17K images with their dynamic consensus protocols. And they labeled annotated almost 500,000 annotations through this process. Now, we also applied an algorithm called Individual Typology Angle, or ITA, to these images. ITA is a commonly used algorithm in this space, and what I mean by commonly used is there are published papers that use ITA to estimate skin type, and ITA is a computer vision algorithm that transforms RGB values in an image into a single metric for constitutive pigmentation of the image. And we specifically use a YC-BCR mask, and what that does is it masks out non-skin-like pixels in an image such that you can avoid clothing or backgrounds that are otherwise not skin-oriented. And in fact, ITA is best done on segmented images, but generally it's hard to get those segmentations. So we're doing ITA on a masked image, which is slightly better than ITA without the mask. So before I compare the experts, crowds, and algorithm all together, I want to share how experts compare to each other. So here's a qualitative look where we've plotted images based on two experts' annotations. And as you can see, there are examples where expert 1 labeled an image with Fitzpatrick skin type 4, whereas expert 2 labeled it with a 1, and vice versa. Board-certified dermatologists, the experts in their field, will not necessarily annotate the same image with the same score. Here's a confusion matrix showing the same two dermatologists over the 320 textbook images that they labeled. And what we see is that annotations between two dermatologists line up exactly in about 50% of images. That's about half of images that you're getting the exact same annotation out of the 6 categories that you might choose, and a 7th category being not applicable. But if you take a close look at the confusion matrix here, you'll notice that the experts rarely disagree very much. In fact, expert annotations are within 1 unit of each other in 93% of the images. So when we compare the 3 experts to crowd consensus protocols in an algorithm by their Pearson correlation coefficient, we get the following heat map. And as you look at this, you'll notice that the Pearson correlation coefficient is in the 0.85 range for experts and the crowd consensus protocol when you compare all those to each other, but it's only in the 0.65 range when you compare the algorithm to either the experts or the crowd consensus protocols. And in the paper, we conduct tests of statistical significance, and we don't find a statistically significant difference between expert labels and crowd consensus labels, but we do find a statistically significant difference between algorithmically produced labels and the other methods labels. So in addition to the Pearson correlation coefficient, we can evaluate inter-rater reliability with Cohen's kappa. We see the same results when using the quadratic rates for calculating the kappa score. And just want to mention that this was a short intro to the paper, but if you check out the paper, you can learn a lot more about it. We'd be excited to hear your feedback on it. And I want to mention a special thanks to Scale AI and Centaur Labs and all the crowd workers who participated in this experiment, and the collaborators who participated for making this work possible. So thank you very much, and feel free to reach out.